We're going to clean the area with some antiseptic, just where we're going to do those injections. So I'm going to start just right around the orange line, and we're just going to do a ring block all the way around. And I'm going to use about 4 of these. So typically 1, 2, 3, 4. That usually works very nicely to anesthetize, but then we'll test the patient before we do anything else. All right, Carson, you ready? It's going to sting just a little bit, okay? Okay. And hang on with me there just a minute. And just all the way around, right above. So you can kind of see where we started right there. Just going to back that right back up. Okay, turn your head right there. Just relax. So we're letting him get good and numb there. Would you tell me if you feel anything, Carson? Do you feel that?
Barely. But yeah. Barely.
Barely?
Yeah.
How about back here? Feel anything?
Yeah, I felt it. Yeah, I can feel that.
Is it painful?
No, it's not painful.
But you just feel a touch?
Yeah, it just feels like some infection. It's not, I barely feel it.
Barely feel it. Okay. So we'll give him a couple more minutes here to get good and numb. And this is the PPP, platelet poor plasma. Okay, we have about 16 cc's of that. This is the PRP, the platelet-rich plasma. And to this, we're going to mix in 2 cc's of exosomes for his hair. So we will end up with about 12 cc's of PRP and exosomes, which I will inject in his hair, concentrating on this area, but then also bringing it back through here to help him for future growth and to keep his hair nice and thick. He's got beautiful hair. So we're going to address his area of concern and then just go back and forth with little aliquots all along to regenerate that and help prevent any hair loss back in here that he's experienced up top. So I am putting a 30 gauge 1/2 inch needle on the 1 cc PRP, and I usually will with 10 cc's of PRP, so I will have 5 of these ready to go. So we're going to start injecting Carson. We're going to start right here. I'm going to stay just a little bit above the area where we numbed. And the area of his concern is this area right through here. You might feel a little bit of pressure, Carson. And I'm just doing little aliquots, like 1/10 of a cc, all the way across. How are you doing, Carson? How much pain are you in, sir? None. No pain. So again, we're going to inject with a 30 gauge 1/2 inch. And I just went all the way across. And I'm going to back up about 1/2 inch. And I'm going to start here again. And go all the way across. And just about 1/10 of a cc with each little injection. So 10. There's not much tissue. It's very superficial. Yeah, very superficial injections. It's not very deep. There's not a lot of tissue there.
So would you concentrate the injection in the area of focus, or it doesn't matter?
Well, I fill this area up, so I'm going to try to help him with preventing what's happening on the front side of his hair happening back in here. So that's why we're doing this area for him, because typically with men that have pattern baldness in their family, their balding area will be this top part. You saw men that have the hair around the head, and then on top it's balder. So I'm concentrating it here where his concern is, but I'm also going back and forth across this area to help prevent him from having hair loss here later. and it will act as thickening his hair as well. And again, about a half an inch back, 1/10 of a cc. So you want to make about 10 injections all the way across. So I'm just refilling those same 5 syringes that I had before. And I'm putting back on the 30 gauge half-inch needle. And we went back to here on Carson, okay? So I'm going to make one more pass, and then I'm going to start at the front and go over it again for him. Carson, how are you doing, sir?
Good.
Are you feeling any discomfort or pain?
No.
No. So with that ring block, he's completely anesthetized, which I love the ring block. It works great for that. So now we have come all the way back to his crown. So we're going to start back at the front again. Areas of concern for him were this area here. So we're going to concentrate and make sure that we get that and help rejuvenate that. And again, I'm going to work on this side because this was another area of concern for him to try to rejuvenate. When you're doing hair restoration, if somebody, their hairline has receded back to say here, so I wouldn't start down here. I would start about 1 inch in front of where their hairline stopped and start there, and then gradually start bringing it forward. And notice he's having very little bleeding. And then I'm going to go right back across the area again of concern for him. And I think it's real important to know that he's feeling none of this.
Yeah, I feel the same.
And I'm just going back over those same areas here for Carson, making sure that we hit everything that's concerning to him. So next I'm going to take the Rebella pen.
You guys have your own pen?
We do, and it's amazing. And I'll tell you, I have the skin pen, I have the
What is this? I don't know.
Rebella microneedling pen.
Oh.
It's amazing. I've got the Rejuva pen, I've got the skin pen, and I almost always pick this one up.
Wow.
Because it's light, it's cordless. I can do probably 8 to 10 patients with this pen before I have to recharge it. I love this pen. So the settings, your depth of your needle is controlled here. So we're going to go, this is 0, and it goes in 0.25 increments, so 0.25, 0.5. I'm going to do about a 0.25, and I'm just going to do a very light stamp over the area. And it's got 16 little needles on the end that are just tiny, tiny little needles. And I'm just going to stamp because, again, I don't want to shear and cut the hair follicles by going up and down or circles. This is a light stamp to stimulate his own growth factors. Okay? And I'm going to use the PPP. This is his PPP here. Again, it's platelet pore plasma. And I'm going to put just a tiny little bit on here. And then I'm going to start rubbing it in. Get it all through his hair. Then I'm going to take the pen and I'm going to put it on about a speed of 3. It has 6 speeds, 1 through 6. I like 3. It's a good to use for the hair restoration. And again, we're on about a 0.25. And we're just going to start right here, and we're going to do just light stamps. I'm not pressing, I'm just stamping. And then I'm just going to follow the little rows that I made with the injections. And again, this is to stimulate his own growth factors because the body is saying there's injury on the scalp, so we need to send collagen and growth factors and repair that damage. So this is stimulating Carson's own growth factors. Let me go back over it one more time to give him that nice light stamp. And you can see that it's very light. It's not too deep. How much of that are you feeling, Carson?
Just like a vibrating. No, I don't really feel it.
He doesn't feel the needles. Your patients will love this procedure. And it works amazing, especially when you use 2 cc's of Rubella Exo, the exosomes. The PRP by itself will have some effect, but you typically have to do 3 or 4 of those in a row, about every 4 to 6 weeks. And you can do 1 of these and get an amazing result. And then to turn it off, you just simply hold down the top button and it shuts it off. Then we're going to take the rest of the PPP and I'm going to put it on here. And it's acting like a little Band-Aid to seal up all those little holes that we just created. I'm just massaging the hands. Okay, so that's that. Now I'm going to take this and I'm going to just wipe off the excess. Now, Carson, let's talk about post-care.
Okay.
So, what do you need to do after having this procedure? Let's tell him what he needs to do. Who wants to start?
No shampooing today.
Gotcha.
No exercise.
Wait, I can't hear anything.
Sleep with a pillow.
Propped up.
Propped up.
Perfect. Yes.
Gotcha.
So for the next 24, 48 hours, you put a lot of fluid in there. So you want to sleep with a couple of pillows underneath your head and sleep on your back because we don't want the fluid to pool to one side.
Gotcha.
You might have a slight headache for 24 hours after this procedure.
Okay.
We put a lot of fluid in there and you've had a lot of little sticks. The numbing will wear off in about an hour.
Gotcha.
So I would say take some Tylenol. Stay away from Advil, Motrin, ibuprofen for the next 5 days. If you need anything for a headache, again, it should be very mild if you get a headache. Take some Tylenol. And it's always good to take some before the numbing wears off and prevent it.
Easy
What
peasy.
questions do you have, sir?
So I can shampoo tomorrow then? Like
Tomorrow?
after 24 hours?
Yes, tomorrow will be fine. So when you get home today, what you can do if you want, I prefer that you just, you can rinse off, because we put a lot of stuff on your head. You can rinse it off with just some cool water and just pat it dry.
Okay.
If it's bugging you, you can do that, but I wouldn't use any shampoo until tomorrow.
Gotcha.
Okay? Any other questions?
I should be good.